Hello and welcome to the Quillen Physicians webinar on the Allscripts version 11.2 Enhancements and how physicians and nurses will be affected. This education is broken down into two separate sessions. Session 1, Enhancements for Meaningful Use. Session 2, Enhancements that Improve User Efficiency. We will now begin Session 1. The first topic is documenting transition of care. The login screen has a new appearance, but functions much the same. Here we are logging into the system as a physician. As you can see, the system immediately takes you to the Daily tab just as before, but there are two additional fields, TC for Transition of Care and CS for Clinical Summary. Both fields are enhancements for meaningful use requirements. Transitions of care are defined by the Centers for Medicare and Medicaid Services as a transfer of a patient from one clinical setting to another or from one provider to another. Meaningful use criteria requires that electronic health records, or EHRs, be able to provide summary information for transitions of care referrals. Version 11.2 enables you to flag encounters as being transition of care. Just single click in the checkbox to indicate the encounter is a transition of care. Next, producing clinical summary documents for patients. Another requirement is that EHRs be able to provide a clinical summary for at least 50% of all patients you see. To meet this requirement, version 11.2 enables you to provide each patient with a clinical summary each time you see them. Once the patient has been arrived, the CS icon on the schedule shows whether a clinical summary has been or needs to be generated for the patient encounter. A green check mark on the icon indicates that the CS has been provided. If the patient declines receiving a clinical summary, NA will display in the CS column. To demonstrate this, to generate the clinical summary, click on the CS icon to open the Print dialog window. Select the appropriate printer and letterhead to print. We're demonstrating a preview of what the clinical summary looks like. We're not going to actually print it, we're going to cancel. Now, working with clinical alerts. We also have to meet the meaningful use objective of implementing clinical decision rules. Allscripts displays patient alerts to notify you when information has not been entered for the patient. As you can see, the patient banner displays a red triangle beneath the patient name to indicate clinical alerts exist for the patient. When you click on the My Alerts icon, the encounter summary displays with the My Alerts section expanded. Right-click on an alert to view a context menu of options. Choose the appropriate action to resolve the alert, and then you'll click Save and Continue. The next topic is reconciliation of medications and allergies. The core set of meaningful use objectives require clinics to maintain an active medication list and an active medication allergy list. The medications and allergies should be reconciled with each encounter. We navigated to the clinical desktop in this example, and an encounter has been selected and the reconciliation has not occurred. Rec Needed is displayed and highlighted, signifying that it is still waiting to be completed on the visit. During the encounter, review the medications with the patient, make any necessary corrections, and click the Rec button. The display will then read Rec Done, and the highlight is removed. Each clinic will need to decide the workflow for med reconciliation. Also new is that we now report if the patient is not currently on any medication, and this will be reconciled with each encounter. Search for No Reported Medication, and we suggest you make it a favorite by right-clicking and choosing Favorite Item, and No Reported Medication will be displayed. You'll commit this as usual. When you add a medication later on, No Reported Medications will drop off. If the medication is completed or removed, No Reported Medications will return to the list. Next, documenting smoking status. We want to reinforce that smoking status is a requirement for meaningful use. The easiest way to document smoking status will be from the red alert icon. Single click on the icon to open the encounter summary, right click on smoking status is not documented, and select the most appropriate response. Another way is to open the ACI. Under the Active or Social History tabs, you will search for smoking status. Make sure you select a smoking status with MU in the secondary tab. Only these will count for meaningful use. If you select one, you'll see the alert drop off. Ordering interventions. Another requirement for meaningful use complaints is that we track patient-specific education resources with the EHR. For example, a patient with diabetes should receive diabetes education, and it needs to be documented within the EHR system. To demonstrate this, we have selected a patient with hypertension and diabetes. We will go to the RX Order tab and the Instructions Secondary tab. We're going to highlight hypertension and search for education material for blood pressure. I'm changing the view to single column so it's easier to read the choices. Simply select one or more of the options by clicking in the checkbox. The Order Details window will open and complete all required fields, which are highlighted in yellow. Then save and return to order the intervention. The last topic we will discuss during Session 1 is immunization reporting. Meaningful use also requires that we demonstrate the capability to submit electronic data to immunization registries. To do this, we must obtain the patient's consent. We will now demonstrate how to record and submit immunization information in Allscripts. Click on the Add New Order button on the clinical toolbar. This takes you to the RX Orders primary tab and Lab Procedures secondary tab. Navigate to the Immunizations secondary tab. Select the checkbox of any immunization. The Immunizations detailed page displays. In the Order Entry tab, complete the appropriate order details for the immunization. Once that's done, click on the Record Admin tab. In the Administration's Details section, add or edit the appropriate information. In the Clinical Questions section, there are 3 required fields. A white box indicates that an answer is not required. The light yellow box indicates that the order will not go. It will go into an on hold status if the answer is not entered. And a bright yellow box indicates that an answer must be entered before being allowed to save the changes. We're going to complete these fields. The bright yellow field has 2 options. Patient's consent. They will either deny or grant, which will allow the immunization to be transmitted to a registry. Once you've completed all the fields, commit to save the changes to the patient's record. This concludes Session 1 of Allscripts version 11.2, Enhancements for Meaningful Use. Please view Session 2, Enhancements that Improve User Efficiency. Thank you for attending. If you have any questions, please feel welcome to contact us through the Help Desk.